So hi, Dr. Chetan. I would like to know more about the MRCP PACES exam now.
PACES exam, the full form of which is Practical Assessment of Clinical Examination Skills, all right? And it is one of the part of 3 exams which you need to get MRCP diploma, all right? And also, it is one of the criteria to enter specialty training, okay? So you can't enter specialty training without finishing PACES.
Okay.
There's one important fact you need to know before we move on, that in order to give PACES exam, you must have passed part 1 exam, all right? And that should be within 7 years of attempting part 1, okay? So you have 7 years to finish part 1 before you can attempt PACES.
So can you tell us where can doctors take the MRCP PACES exam?
Yeah. You can take PACES exam in UK centers and non-UK centers, all right? And non-UK centers are available in many countries around the world, okay? And also, when you go for the exam, there are 2 kinds of settings available. One is a hospital setup in which they conduct exam inside the hospital, like a outpatient department, or there are something called clinical examination skill centers, right? So they have it could be a post-grad or education hall, which they convert it into the examination center.
Can you tell us what the examination involves, like how the exam is?
Yeah. So the exam is conducted by having 5 stations, all right? And each stations, either they have actual patients with medical conditions, or they will be surrogates who do role play, all right? And in each station, you have 2 examiners independently examining you, okay? And they test you on 7 core clinical skills. Let me name them, right? They're called physical exam, all right? And identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patient concerns, and maintaining patient welfare, all right? So they test you on each of these categories and give you marks accordingly. And different stations have different skills tested. And now if you see the circle, all right, so there are 5 candidates starting at the same time, all right? And each one starts at a different station when they start, and they end up in the station 1 behind that, okay? So station 1 has respiratory system and abdominal system examination, and which lasts 10 minutes each, okay? And then station 2 has just history taking, which lasts 20 minutes. And station 3 has cardiovascular system and nervous system examination, again, which lasts 10 minutes each, all right? And station 4 has communication skills and ethics, which lasts 20 minutes. And station 5, which is a very important station, has 2 patient encounter in which lasts each 10 minutes, and which is called integrated clinical assessment, in which you get to do history taking, clinical exam, and explain to the patient, and also do a management plan.
Okay. Do you have any time interval, like a gap between all of these stations?
So there's 5 minutes interval before you go to the next station, so that you can take a break and take a breather. And so the total of, when you calculate each station as 20 minutes and 5 minutes break in between, it comes up to 125 minutes, all right? 5 minutes, a little about 5 minutes, about 2 hours.
Can you tell us in brief about how much this examination costs?
Yeah, it costs you £657 in UK, and it costs £1,202 in a non-UK center.
What advice would you give to a new doctor who is going for MRCP PACES exam?
I think you need to have a plan and goals in place. Okay, it could be 6 months goal, or it could be 1 year goal. First thing is books. There are several books you can study, but all of them are good. But what I studied was an aid for MRCP PACES, and group study is very valuable and very important for this exam. That's what I did, and you need to practice among each other. Colleagues, so one being the patient, another being examiner, and then reflecting on each other and giving advice, and asking how you did. In UK, you have supervisors in your training periods who helped you with that for preparation. Okay, and there are several courses available, both in UK and non-UK. All of them are good. I attended at least 2 courses before I gave the exam, and a bit of all these will help you to excel in this exam.